Hello, my name is Lindsay Shuck. Thank you for joining today's Family Office Network's webinar series featuring Axio Health. I would like to take a brief minute to introduce our three speakers today. Starting us off is Noel Guillama, president of Axio Health. Noel began his career in the family construction business and then became an angel investor in healthcare and switched his career to acquisition and management for medical practices. Carl Larson, Executive Vice President and COO, is also joining us today. Carl has over 35 years of engineering and construction, owning and managing both small and large startup organizations with upwards of 30 million in revenue and more than 350 employees in engineering and construction. Lastly, Greg Steinberg. Greg is an outside board member and vice chair. Greg is currently the CEO of Greenway DNA, a DNA testing solutions provider. Greg was president of an early stage company that under his watch generated $2 billion in organic revenue, grew to over 2,000 employees, and was in the top 10 of the INC 500 for 2 consecutive years. At the end of today's presentation, we are going to have time for Q&A. We encourage you to send over any questions at any point using your questions chat option on your screen.
Thank you very much, Lindsay. Appreciate the introduction. Thank you to everyone that has joined us. Good morning, good afternoon, or good evening. First, the necessary disclaimer that we're required to show you at this time. Second is going to be a mild agenda of what we're going to be talking about. But before I do that, I want to give you, I was taught a long time ago that you had to have a really good 60-second pitch, an elevator pitch. So I'm going to give you that, and then we'll go on to the main presentation while you look at the agenda. We bring 30 years of experience in healthcare, combining physical assets, medical operations, and technology to change and transform the experience of the consumer and the provider with technology-infused care. As I like to say, the first 500 million will be the easy part. As we succeed, we will empower the patient, enable the providers, and advance the science. To investors, we bring a new model that is built to continue to create value and reward them along the way. We have all witnessed the incredible crisis that has been created by COVID-19, and the impact it has had on healthcare has been historic. Nothing like this has ever happened before in the healthcare industry. In part, we've seen over 1.5 million people lose their jobs. That is a problem for society. That is a problem for doctors. That is a problem for the industry. However, it also poses opportunities for those that are ready to jump on the opportunity. The healthcare industry in the United States is a little over $3.5 trillion. It has grown exponentially over the last 5 decades. It has clearly had a major crisis this year, but we expect to return back to normal, in part, Carl will tell you, because we continue to have 10,000 new retirees enter the Medicare system. Our presentation and our company's future is built on a couple of fundamental pillars. One is we want to change the structure and the way doctors are paid and literally the way patients receive care. In part, we're going to use that by advancing technology that is going to be much more patient-centered. A couple of years ago, we heard of 3 major companies entering the healthcare space, and everyone had very high expectations. And that was obviously Amazon, JP Morgan, and Berkshire Hathaway. And they created a company that has become to be known, Haven. A few days after that, while I was in San Francisco in Silicon Valley, I wrote a blog. And by the way, you're welcome to look at a couple of 100 blogs that we have written as a company that basically said we seriously doubted that they would be successful in their approach. The headline that you're looking there on the right is literally from Bloomberg, basically saying they failed to disrupt healthcare. Why did we say that? Because at the end of the day, what they created was a purchasing alliance. And the only way to transform healthcare was to change the way physicians are paid, change the way consumer interacts with the system, and the aggregation of technology that includes a robust EHR, a dynamic Internet of Things, as well as telemedicine. All of those are key components. Why is that important today? Well, the chart that you're looking before you is literally the growth of Medicare spending from 2010 to 2029. And that is not expected to change at all. you can see that it is expected to double over the next 10 years. That is both a crisis for a country, but also an opportunity for those that are able to take advantage. The way we've structured our company is we have a clear path to that 2030. It goes back to structure and value-based care. It goes back to comprehensive patient-centered care and incredible deep use of technology, not separately, but together. We have to fuse those two together, and we've got the experience and the technology to do that. We've literally licensed 20 issued patents and 20 pending patents. Plus, as I noted in my little elevator speech, we've created a new model that allows investors to participate in the growth of the companies going forward. How we got here. Originally, the company was founded in 2008 and was effectively the R&D arm of our parent, or was our parent, to create the EHR platform. The original vision was to create a technology company. Having brought 20 years of experience in clinical operations to that creation of the technology. What we discovered, we know now, looking back, is that technology in healthcare is literally just creating another silo without changing the way healthcare is provided. So we needed a provider in the technology company, and the technology company needed a provider. So we had to put those two together. So we've been working on this plan for a couple of years, and literally a few months ago, we changed the name of the company to Axio, and we've updated our vision. The vision literally is to combine the provider of services and the technology to, again, change the experience that a provider is going to have. After a $100 billion investment in health information technology, we have no measurable improvement in the quality of care, and it has not changed the needle one bit. And we think that's the problem. You had technology companies on one side, you had healthcare delivery companies on the other, and it doesn't work. We can tell you that from experience. So we created a unique structure, and we're coming out to the market with 5 subsidiaries, and Carl will go into the deep part of it, that basically deal with the service of healthcare and the technology of healthcare. So in front of the National Archives of the United States, there's literally a statue that basically quotes William Shakespeare. And that statue basically says, it's quote from the Tempest, it says, the past is prologue. The reason why that's important is, in fact, if you become investors of our company, you're invested in the management team, and you're investing effectively in that experience that we have. The experience that we have in running medical centers, operating diagnostic centers, operating networks of doctors, managing that relationship, and being influential in the creation of key medical infrastructure in the South Florida marketplace. We also, as Lindsay's introduction, have a tremendous experience in real estate and construction management, in building facilities and managing facilities. And we also bring a material amount of technology experience, having built multiple systems, multiple platforms, been certified by the US government certifying agencies for an EMR platform that is today based in the cloud. We have the patents that we've talked about also have been incredibly successful in building other types of platforms in healthcare and in customer relationship management. One of our big goals is, we've done this with third-party developers. One of our use of proceeds is to bring that development in-house. We also have a material amount of experience in the financial side, including the acquisition, consolidation, and integration of healthcare practices. We've been able to negotiate with over 10 national health insurance companies. We've done a number of reverse mergers, IPOs, and also, very interesting, is we've been involved in managing large endowments. And we think that's very key to the unique structure of what we'll talk about later, our distributive venture platform. We've also been able to manage companies from literally dozens of employees to hundreds, even 2,000 employees. So we bring a lot of experience and depth into this project, and we believe that it certainly is going to lead back to our success. Let's talk a little bit about our patents that we've licensed. They include 20 patents, and as you can see here, it's a pretty broad range, all about data, analytics, information, tracking, and even augmented reality. And we have now 2 that are pending in the blockchain. Going back to the way we've structured the companies and the 5 companies, we have identified a couple of big problems. Problem number one is poor patient experience in healthcare, the lack of patient-centered care, the lack of integrating, as I said before, the technology with the actual operations. So you ended up with a technology company that was trying to find operators as clients, and then it became difficult to service those clients because those clients had unique needs. The service providers always wished they had the technology companies because if they wanted to move something or enhance something, they had to wait till that technology company changed it. We've gotten to a point, and particularly because of what's happened with COVID, that we can no longer wait for that. And the GDP will continue to grow in healthcare, certainly for the coming 10 years. If you look at this graph, it tells you about how much our gross expenditures of healthcare have grown literally since the 1990s. And you can see here that even recessions do not temper that growth. What we're missing is that transition from fee-for-service care to value-based care, or we'll talk about later sort of capitation, where the insurance companies literally pay us to take care of their patients and make sure that patients are healthy. The doctors that have been in those models for the last few years are not seeing the negative disruption that's affecting their practice today. And we believe that by the integration of Internet of Things, or literally wearable devices, will enhance with a universal healthcare record the remote care of patients, and that's going to change the outcome for the patients. So we bring those solutions. In technology, as I said today, we've also seen that over $100 billion have been invested in health information technology over the last decade. The government alone has invested over $36 billion into this space. And yet we have seen no material improvement in the quality of care. As a matter of fact, we've created a lot of stress for the care providers and has been credited with one of the major contributions for physician fatigue. We have to develop new systems and new delivery systems at the same time. So that's basically what we bring, is we bring a solution to a comprehensive data-driven solution that brings together the patient in control of their data and brings solutions for the doctors. The doctors that I have experienced, and I have worked with literally thousands, love using technology that makes their life easier. What they don't like using is technology that creates more burden for them, that after they see the patient, they have to go back and document all the work that's been done. And effectively, all of that $100 billion that we have spent in health information technology has effectively been designed around systems that were created around billing and collections. The third thing that we have noticed, certainly from the endowment perspective, is that a lot of money has been made by venture capital. And many times, most investors, accredited investors, family offices, do not have access to those venture capital investments. When they have access to the companies, they're, I'm going to say it bluntly, they're sort of dumped onto the public at very high valuations after literally almost all the value has been extracted. And recently, PitchBook literally said that the VCs backed IPO have done poorly compared to the market. So there's an opportunity and something that we clearly want to change. So what we want to do and what we're doing is we're basically creating a new platform that we call Distributive Venture Platform. And that platform is designed to share with our investors as we create these companies that where they will receive a dividend in these companies. And as we'll talk about later, they will have a direct ownership in these companies. It allows us to create multiple opportunity and create value, and also create multiple opportunities for liquidity, depending on what the investor's interest is and what their appetite for risk is. So we're changing a lot of things, but it really are changes that should have happened already. So with that said, I'm going to turn it over to my partner, Carl Larson, who's going to talk about the 5 companies that we have allocated. Maybe we'll talk about the other 4 later on in the presentation. Go ahead, Carl.
I appreciate everybody being here. We thank you very much for joining a webinar. It's our pleasure to and our privilege to be able to share this with you today. I want to just take a few minutes as I go through these companies and simplify this for you somewhat. This is a very, could appear to be a fairly complex organization, but it's really not. The 3 companies you see at the top in black and white, we refer to as our captive companies, because what we're doing is creating critical mass. We're creating a cost improvement by funneling into these companies basic features and functions that would be normally provided and normally done by these 5 companies. But because they're repetitive, we can take significant economies of scale. For instance, in administrative services, we'll have finance, administration, payroll for all the companies. They'll all of this be done under contract, of course. The construction services, we'll discuss that in a little bit, but we have a licensed construction company that is one of our captive companies, as you can see. And then the healthcare technology that Noel mentioned, that would be our in-house software development team, as well as our in-house IT group. So let's go into the companies. We're going to talk about our 2 companies, Total Care and CareWork, that really address structure. All of the 5 companies individually, but collectively, hit every touch point that is critical in the healthcare system. And those touch points are the payer, the provider, and the patient. Now, these 2 companies are addressing the enabling of providers. The first company is Total Care, and we'll get into, that was my mistake. I want to take a moment and talk with you just a little bit to set up how difficult the situation is in healthcare right now since the pandemic. You can see 20% of the primary care physicians are looking to close permanently across the nation. That's a tremendous loss to the community-based care in our nation. 55% said they're not prepared for another pandemic, and 76% report they're in severe stress. Many that we've talked to have confirmed that these are key issues the primary care practices are facing. But there's also a bleed over into the population. The Kaiser Family Foundation surveyed 2 million of their members. 48% that responded said that they had delayed or postponed needed medical care. 11% of those that delayed or postponed said their condition worsened. So there's a tremendous situation coming. It's almost like a tsunami, a rebound effect coming into healthcare, because many of those whose condition have worsened now are beyond the help of the primary care provider, and will have to go into the hospital system where costs are going to escalate. Just one small data point here in addition, we found that it was reported in the latter part of April, 30%, the cancer diagnoses had dropped by 30% nationwide. Now we know that cancer didn't go away by 30%. Those are cancers that did not get any treatment at this point in time, and that could be serious for a fast-moving cancer. So our first company we're going to discuss is Total Care, our 4th generation healthcare delivery company, one that we've done before, and will be providing community-based care. But most importantly, it will be contracting with an insurance company and working with both the patient and the provider to improve the health of that patient. And also we'll be buying and purchasing the provider practices. So we'll be rolling up provider practices into Total Care. The Total Care will be addressing principally Medicare Advantage enrollments and Medicare patients. You can see, and as Noel had mentioned, 10,000 Americans are reaching the age of 65 every day, and that number is not going to decrease for 9 years. So that's a lot of people that will be entering our Medicare system in the United States. And you can see by this graph how quickly those numbers are growing even now. Total Care presents a tremendous opportunity for growth. As you can see in the graph, Medcare, which was a company that Noel had started a few years ago, and left to start what we're doing now, had some tremendous growth, and in 4 years, just a short period of time, saw revenues grow to over 120 million. We, based on that experience and other experience since, believe we'll see an annualized recurring revenue of 8,000 per patient per year. Now you multiply that by a significant number of patients, and that number begins to fit that curve. We will be acquiring practices, and we believe we'll see a 200% increase in their revenue over a 4-year period. One of the significant powers of the concept that we have is the cross-utilization of technology. The electronic health record program that we call POWER, or PWER, stands for Personal Wellness Electronic Record. And we'll get to that in a moment. We're going to be utilizing that throughout Total Care, and we'll also be utilizing the other technologies as well. Those technologies will help us to better care for the patient and reduce the hospital cost and the healthcare cost of those patients. The next company we're going to discuss is CareWorks. CareWorks is our real estate and healthcare facility company. We intend to buy what you see in the picture. Those are pictures of Walgreens pharmacies, CVS pharmacies that have been shut down and are now vacant. We intend to buy those and repurpose those, and then utilize our Total Care medical groups as anchor tenants. We'll be able to deliver back into the community a tremendous amount of care through these locations. And indeed, one of the areas that we would envision putting these would be in an economic opportunity zone, so we can take advantage, not all of them, but at least 1 out of 3 in an economic opportunity zone, to take advantage of the cost and tax benefits that would come with that. So again, with CareWork, we're enabling our providers and giving them a place where they can cost effectively treat their patients. The increasing pressure that we already discussed on the physicians and providers that is driving many of them out of into closing their practices is real. The cost to equip a new practice, you can see, is 50 to 100,000. In addition, leasing office space incurs major liabilities. So our business model here is to provide locations where a physician can meet and treat their patients in examination rooms that they lease on a relatively short-term basis from us. But because of the cost advantages, that short-term lease is going to be turning over and over and renewed again and again. And the physicians we've talked to have confirmed that this is exactly the kind of thing they're looking to be able to do to reduce their cost burden. Next, we want to discuss the 3 healthcare IT companies. PWER for Personal Wellness Electronic Record, Personal Wellness Blockchain Record, and a company we call Blue Box. POWER, or Personal Wellness Electronic Record, is a electronic health record program. Well, already mentioned that we have it is certified. We have invested over 8 million in developing. It's a software as a service model, cloud-based, that includes, in addition, practice management, disease management, patient billing and scheduling, and connects to 90% of the pharmacies in the United States. In 2021, when we complete the upgrade to the mandated Meaningful Use 3, it will contain a communication package that will address telemedicine, encrypted chat, and audio, which is all of the communication features that are being desired by physicians today. POWER has been deployed. It's in use. It has a unique feature we haven't seen in any of the other electronic health record programs that allows simultaneous access by multiple providers. A cardiologist, immunologist, a primary care physician, surgeon, anesthesiologist, they could all get on the same patient record at the same time and discuss that care of that patient. It's a tremendous advantage to physicians because they can do an immediate consult. The platform has multiple patents that address the functionality, and as I already mentioned, 90% of the pharmacies in the U.S. are connected. The next platform is our global platform, and I say it's global because it will be a blockchain record, patient-centric, in that the patient will have total control over who accesses their medical records. It will provide an advancing of science, because the records, with the permission of the patient, will be available to academia as well as pharmaceutical companies for research. A tremendous amount of information that is available that is not being utilized, and certainly that is what is being utilized is without the patient's permission. We intend to be able to reimburse the patient as well for the use of their medical records. The blockchain allows data access and connectivity across national borders, so this program will become a full global program. Pardon me, go the other way. As I said, this platform will be advancing science. It will be fully loaded with AI and advanced data analytics. It will empower the consumers with highly secure authority over their personal records, but yet at the same time provide the ability to unlock high-value patient data that exists, that is now siloed among all the other electronic health records. So we feel that we have a tremendous opportunity with both Power and with PWBR. The next platform we've called Blue Box, and Blue Box is a IoT, in other words, an Internet of Things platform that will reduce the cost of care by accessing wearable device data that is being worn by the patient or by the individual. This is more than just patient care. This is getting also into providing the feedback and information that is being collected on wearable devices, period. If we look at this graph, we'll see that wearable devices have been increasing at the rate of over 20% per year, and a lot of valuable data is being held up in these manufacturers' programs. There's very little way presently to access that data and make use of it, yet it is extremely valuable. We will, with Blue Box, capture and integrate that data and then provide it back to the user, whether that user is a patient or that user is a consumer, such as an athlete, or by pushing that data into an electronic health record program, or in other words, into Power or PWBR or any other EHR that an individual would authorize, so that their physician has immediate access to very real-time data that has coming through the wearable device that individual has. So we are empowering the patient, we are enabling the provider, and we are advancing the science through these three programs, all five companies, but in particular through the healthcare IT programs. So at this point, I would like to give you a quick review and just kind of reiterate that with PWBR and Blue Box, as I said, we are empowering patients with Total Care, CareWork, PWER, and Blue Box. We are enabling providers, giving them not only a location in which to work more efficiently and cost effectively, but providing them with patient information they don't really now have, and then advancing the science in Power and PWBR and Blue Box. So we have collectively created an ecosystem now that is hitting the key touch points within the healthcare system. I'd like to now bring Greg Steinberg on, and Greg is going to talk to us about the finances. Greg?
Thank you, Carl. I appreciate it. And for everybody listening in, as we're not interactive on this, I'll remind you that there is a question option on the sidebar for you. If you have any questions, we'll have about 20 minutes for Q&A in a few minutes, and happy to answer any questions you have that we haven't answered by the time we get through the end of this. So if you think about what Carl and Noel have been chatting about, we've deployed in excess of $8 million to have power ready to commercially scale. We've taken the time, the energy, the money for 20 issued patents and 19 more that are still pending. And to a certain extent, you could think of us as being almost in stealth mode. We've been in the hangar on the side of the runway, getting ready to come out and to take off. We're at that point now. We're ready to roll out of the hangar, get onto the runway, and lift into the air. In order to do that effectively and put enough gas in the tank, so to speak, for that takeoff and to get us some momentum, we're going to put out to you an opportunity to invest with us at a foundational level on it coming out of this stealth mode in a convertible bridge note. This note will convert into our Series A in a traditional manner. We expect to close this note over the next 30 to 60 days and then immediately go into our Series A raise, which this note will convert into. This is an 8% interest-bearing note converting at a 15% discount to our Series A. And we expect that our Series A, which I said we will commence as soon as we close the bridge note, will be in excess of $100 million. The utilization of capital, if you go to the next slide, utilization of capital will be across all the organizational structure that Carl just showed you on that org chart. At the top level, in terms of the OXIO parent, in terms of our senior team, the support staff that we need for those 3 boxes in the black and white components to support each of the individual portfolio companies. Each of the individual portfolio companies on both the infrastructure side as well as the technology side require their own teams to be built out and individual components that are specific to them. In Total Care America, looking at individual practices that we're going to acquire, getting those practices under letter of intent and doing the due diligence on them so that when we close on our first tranche of the Series A, we're ready to execute on those acquisitions. In CareWorks, to look at the properties, a few of those properties that Carl showed pictures of as an example, to negotiate the acquisition terms on those, to look at what needs to get done in terms of zoning and build out, et cetera, and to have those ready to close on when we get the Series A first tranche closed. And on the technology side, each of these individual companies, on the health and wellness side, on the blockchain side, on the IoT wearable device side, to start to build out the development teams, our own technology teams, et cetera, as we ramp those up, as those will support the efforts that are taking place within Total Care America acquired practices, and both those and other affiliated practices that are utilizing our CareWork clinics. And of course, we have some fees that are going to have to get expended in terms of supporting the licensing of these 20 issued and 19 pending patents and other IP assets that we have. Next slide. If you take a look at, can you go to the next one, Carl? If you take a look at the individual components that Carl was talking about, Total Care, CareWorks, and the technology side, et cetera, you'll see that Total Care, which is the orange line, the highest line on the graph, is really the core engine of the company. This is the component that drives everything else. Each of the other components are other components, the drivetrain, the electrical system, the transmission, et cetera. But the core engine, the 12-cylinder component, is Total Care. As we launch, you see we're only clicking on a couple of cylinders. And as we leverage over time, each of the build out of the other companies, 12 cylinders going into years 3, 4, and 5 are really burning on all cylinders. So that you see that Total Care is the engine that will drive the core components. The next 2 lines in year 5, the blue line and the green line, which have slower ramp ups, but end up as being the second and third largest components of the company, are based on technology, data aggregation, and the ability for us to leverage that data and that technology into research and other utilizations of all the core components that we have. Each of the companies feeds one another, and each of the companies supports one another. If you look at what this means on an aggregated basis, on an aggregated basis, over 5 years, this means we're driving towards $1 billion worth of revenue on an annual basis and in excess of $400 million worth of EBITDA. And if you think back to the slide that Carl showed with the Medcare numbers of getting to $120 million worth of revenue in the first 3 years, that was only on one of these components, the total care components. So this is a process that we've already lived, we've gone through, we know what to expect, and we know what we need to put in place to do it because we've already executed on it in various functions before. The market is ready. The market is asking for change. Physicians are asking for the answers to the questions that they have, and consumers are technology aware and ready to adopt technology into their lives. COVID has just accelerated this process. We've been thinking about it for decades. Ultimately, through the aggregation of our distributive venture platform, as an investor, you have an opportunity to be at the ground floor of each of these core components, and we invite you to join us along this journey. Of course, it's all about the team, as Noel mentioned at the start. So, Mel, can you come back and talk a little bit about how we're going to execute on this?
Thank you, Greg. So, as Greg noted, as I talked earlier, we have been through a number of these organizations. Literally started them. We started with technology, ended up in services, back to technology, and the one thing that life and experience has taught us is that just like other industries, and I'll mention a couple of names that will come right to mind, it's really, really impossible to make a change without combining both the service and the technology. One of my favorite examples is to talk about Federal Express, is the way Federal Express controls their product, their delivery, their airplanes, the services, with extensive use of technology. For decades, we have tried to bring technology to healthcare, and it's been in silos. You had a technology company and you had a service company, and that's the way they saw themselves. The reality is the only way we're going to be able to change the needle and improve the experience is by combining. Forget about looking at them separately. As Greg said, you know, his favorite car has 12 cylinders. Let's go back to the car. We're going to build cars, not just, we need an engine and a transmission and a drivetrain. That's the only way we're going to make a major impact in healthcare and frankly change the experience for the provider, the patient, and we'll talk about later as sort of the payer. So we bring a lot of experience to the table, having done that and experience that, and all the heartache that comes with experience that. So one of the things that investors always want to know is about exits. You know, listen, I have been very honored to do a couple of IPOs in multiple public companies, but we have a unique model that we have designed that allows us to spin off an individual company into a separate IPO in the future. It allows our individual companies to be acquired. In fact, Medcare was acquired by one of the largest insurance companies in the United States. So that's possible. It also allows for our companies to be acquired and merged into existing platforms, whether they be in venture capital or private equity. There's also an opportunity for the entire enterprise to be rolled up into a SPAC that's looking for an innovative company that is ready to change the biggest industry in the United States, which is healthcare. My personal favorite is an IPO. And the reason I say that is part of the experience in buying practices. The first practice I bought in 1991 is that I want to use that stock and that equity component to continue to incentivize the physicians and encourage their retention. So an IPO is very important. And we've done it. We made it work. So something that we're very committed to. So in summary, we want to create a new paradigm for healthcare. And that new paradigm looks at all of the components in healthcare that goes to the structural problem, the data problems, the opportunities to bring new solutions to investors. We bring all of those solutions today. And our goal, as we started at the beginning, is to empower the patient, enable the providers, engaging the providers, and advancing the science, and to create a very dynamic company that has all of the components to help transform healthcare, which is an industry that's been talked about literally for over 100 years. Teddy Roosevelt literally has talked about transforming healthcare in his presidential run, and we haven't done it. And I think one of the big key reasons is we haven't integrated the service with the technology, with the patient, and that's the thing that we're bringing together, and we're bringing this opportunity to you right now. So as Greg said, if you have any questions, we'd love to hear it. We'd love to address it. We have a few minutes left, and we're certainly willing to engage on a one-on-one basis. Greg, you're controlling the questions. Do you see any questions that we should address?
Oh, Greg, you're muted. And thank you, gentlemen. Yes, as Noel said, we do want to encourage questions to come through so we can have that open dialogue while we have the OXIO team here live. Please use your questions chat option to send them over when you're ready.
Right. So, Carl and Noel, let's start with one of the first questions that's getting asked, which is, why hasn't this been done before?
Well, that's a really, really good question. And like I said, I've been in healthcare for 31 years. And I think the way it hasn't been done before is healthcare is literally the hardest industry in the world to impact. And as we saw earlier in the slide, when you had Berkshire Hathaway and Amazon trying to change an industry, you have to look at it in a different perspective. If you keep doing the same thing, you're not going to change the industry. And one of the examples that I like saying is that, back 200 years ago, it was very common when someone was sick is to literally do bloodletting or literally draw blood from them, thinking that the sickness was in the blood. That wasn't the solution. So in order to look at the way healthcare needs to be changed, we have to change the doctor's experience, because it's very important. We have to change the patient experience, and we have to use technology. We have thrown $100 billion into health information technology, and we really have zero to show for it. So we've got to look at this much more comprehensively. And we've got the experience of literally running healthcare delivery system, running networks, certainly with the technology, and bringing the innovation. That's the only way we're going to change this, Carl and Greg.
Yep. Great.
Noel, maybe a question for you. Greg mentioned that Total Care is the engine. How does that work from a revenue perspective, and is that tied to capitation?
Well, the way what's been happening, as you saw a slide that Greg showed, that Carl showed in Medicare Advantage, over the last 20 years, Medicare has been incentivizing and allowing insurance companies to bring more of their members into Medicare Advantage. About a third of all Medicare members in the entire United States are now in Medicare Advantage. And what that does is that aligns the incentive of the payer, the insurance company, with the consumer and the government who's paying for it. It's not about transactions. It's not about visits. The reason why we're seeing the collapse in healthcare over the last couple of months, both at the hospital and the provider level, is overwhelmingly the industry has been built on encounters. Think about that as a toll booth. So if there's no cars going through the highway, there's no tolls being generated. So if a hospital has to eliminate or severely restrict what's called elective care, which some of the time it's not elective, it's just not emergency care, you're affecting the revenues. Yet on the other side, the doctors and the groups and the systems that have been receiving capitation payments, they continue to receive those capitation payments regardless of what's happening, because the government continues to pay the insurance company, the insurance companies are continuing to pay the providers. So that's why we think that the COVID has created a couple of opportunities, and I'll jump to a couple of them. One is it's letting the providers in the hospitals, who are the biggest resistors in capitation or managed care or value-based care, to realize that's an opportunity. The The second opportunity is for the providers that are now stuck in the middle of a system that's undergoing change without revenue. So we think that's a sad state of events, but it also can be an opportunity for companies like us. And last but not least is the retail space seems to be collapsing. So that gives a tremendous time to come and enter and acquire the properties.
Great. Thank you, Noel. Appreciate that. And I apologize to Stephen and Susie who asked the first two questions. Third question coming in from Shahid is, what funding has been undertaken to date?
Can you repeat that again, Greg?
What fundraising has been undertaken to date?
The fundraising has been very limited, as you sort of said, a little bit stealth. What we have brought into the company is multi-million-dollar investments of equity and subordinated debt from the parent. So in totality, almost $10 million has been invested into the company. And this is the first time we're going to sort of non-friends and family for capital investment.
Got it. I appreciate that. Lindsay, I lost the
Oh, no problem. Let's see here. It looks like
another question from Regine. I just can't. It's not showing on my screen.
no problem. It says, let's see, two questions. Providers working from home and facilities need of real estate. Provider, yeah, that's the providers working from home and facilities in need of real estate. And then it says to your telemedicine tech.
All right, so here's the story about telemedicine. Telemedicine has been around in one shape or another literally for decades. I would argue that it really started with NASA and the space program. I was involved in a telemedicine company in the mid-90s. And one of the great things that we have seen in telemedicine is literally, because of COVID, has been the utilization of telemedicine. And that is fantastic. Where I think the last time I saw was a 4,000% increase in some systems. Here's the problem. Telemedicine is very easy to use with people that are relatively healthy. It's relatively easy to use with people that are relatively young. It changes the dynamics once you get into the Medicare space who's over 65, and people have a lot of what is now called comorbidities, which is literally a number of other health issues. So it gets very difficult for a telemedicine operator to come in and try to sort of triage a patient to what they need to do. Now, here's what's different. If you use telemedicine along with a universal or aggregated medical record with your care provider, then telemedicine's value is exponential. So forget about receiving $100, $150 for telemedicine visits. We're going to use telemedicine primarily on our patients, by our providers, with our information system. So telemedicine is incredibly important, but it becomes of less value as of today with people that have a lot of complexities, and which almost includes everyone over the age of 65. So telemedicine is a great tool, but it's not an end solution. And by the way, when you aggregate telemedicine with, again, with the medical group and the EHR, the value is to save money, and in a capitated environment that actually creates more profit. So we're 100% sold on telemedicine before it was. As a matter of fact, about telemedicine and remote care. So we're 100% into telemedicine. However, telemedicine by itself is not going to solve a healthcare problem that America faces today.
Good. Thank you, Noel. Two questions from Richard. Do we have a consolidated balance sheet we could share? Yes, happy to do that with you, Richard, or with anybody else on the call. We've got a full set of financials that we're happy to share, offline, and go into a deep dive on each of the individual companies, et cetera. And do we have any patents? Again, from Richard, yes. 20 issued and 19 pending. And again, we're happy to go into detail on those, on the entire IP portfolio, and we can obviously, with anybody online that's interested, go through those deeply. And then a question from Larry. Do you have a beta client, a large physician's practice, a hospital, or an assisted living facility? Question mark.
No, I don't want them. I don't want an assisted living facility. I don't want a hospital. We are the enemy of the hospital. By the way, I've been in hospitals. I've been on hospital boards, and I respect them and I love them, and I've been taken care of in hospitals. But financially, our goal as an enterprise is to keep our patient as healthy as possible and keep them out of the hospitals. Large medical groups, here's the problem with large medical groups. Most of the large medical groups are not primary care. Most of the large primary medical groups are anesthesiologists, radiologists, OBGYN, dermatologists, which are basically the physicians that have been the most at risk. We want to we want to aggregate, and I've done it 40 times, is primary care physicians. I think that we would be lucky to find a group of 4 or 5. The reality is we're going to do as we did before, is acquire 1, 2s, and 3s, aggregate it, consolidate them, make them more efficient, more effective, and increase our revenues. We have done it. This is not theoretical for us.
Great. Thank you, Noel. And a question on competition. Who's your competition? Who's our competition?
Well, that's a great question. And the reality is almost everyone is our competition. Okay. So if you wanted to parlay it and separate the 5 companies, you certainly have competitions in the provider. There's 1 million providers in the United States. Recently, insurance companies have been buying providers. As I said, they bought a company that I founded. So technically, there's 1 million providers out there that are competition for that space. In the real estate space, there are technically medical office buildings that literally are, sprinkled all over every medical campus, every hospital in the United States. So that's 5,000 hospitals. Hospitals are technically competition for us. If you wanted to go to the technology space, you've got very large companies, not really competition, but let's just throw them out there. You've got the Epic, the Cerners, the Meditechs. You have the Athena, and you have a lot of technology companies, but those technology companies do not have healthcare delivery system. They do not deliver the care. They literally are an outsource. The blockchain is a little unique, and we haven't seen too many in the IoT devices. We've got patents in the IoT that at least says that we've created something novel. So the reality is everybody's a competitor. What makes us different is we're aggregating and putting these pieces of the puzzle the way no one today that I have seen in 32 years has ever done before.
Got it. Okay. And a question relative to timing, which is you're doing the bridge and then the Series A. When do you start acquiring practices, getting real estate, generating revenue?
Awesome. That's a great question. So here's what I think is going to happen based on my experience. We are going to use the money from this bridge financing to staff up the people that have either worked for me in the past. Some of them have actually worked for me 2 or 3 times. We're going to put together the team that's going to do the M&A or the acquisitions. We're going to use the resources to enter with letters of intent with these doctors. And our goal is to close on those doctors literally the day after we close the A round. So we're going to be looking at generating revenue. If we have a 60-day window, in 61 days. If we have a 90-day window, in 91 days. We're going to do the same approach in real estate. Real estate is something that's literally in my family blood. So we've already identified a couple of locations that we want that are around the doctor. So here's a reality. We're going to take the doctors as pods, 1, 2, 3s, and 4s, and we're going to put them in geographically the right location. The right location is where you have the patients, where you're off campus from a hospital. So we're not going to be anywhere near a hospital. We're not going to be near MOBs, and that's why we're building the real estate. So that real estate revenue is probably 12 to 18 months out because it's going to take time to acquire the property, rezone it if it needs to be rezoned. We've already got the architects that are going to design it. So I would tell you the real estate revenue is between 12 and 18 months away. Now, by the way, the reality is that TCA or a medical group is going to be the largest anchor tenant in that real estate. But we want to bring other doctors into the system because we want to create not only an ecosystem, but we want to create convenience to our consumer. The same thing with our EHR. We're going to go in and modify the EHR to work both for total care a little bit better, certainly work in a CareWorks environment, aggregate telemedicine, aggregate the IoT, and we expect the revenue there to be 14, 16 months out, but we'll probably be operating and testing it again in 12 months. And then just beyond that, you've got the revenue from the blockchain and the IoT devices. When we are able to prove that using the right IoT devices and the telemedicine, that we're going to bring down the cost of healthcare, while at the same time we're improving care, everyone's going to be knocking on our doors for that technology. And that's why we think there's an opportunity to literally spin out this technology over time, because people that want to acquire it. We want to continue to use it. We're building everything that we need to use. And by the way, those little ghost companies that you see at the bottom, number 6, 7, 8, and 9, are companies that we know we're going to need, and we're going to be the first customer, and eventually they will provide service to the community at large. I know that was a long answer, so I apologize.
No worries. I think we have got time for one more question, and then Lindsay, if you want to close it out. There are other questions. We do have a list of them, and we're happy to get back to you on email or on a phone call, video call, and answer your questions directly and drill in more with you based on your interest. Last question, Noel. Do you have inter-health institution data stored in your database currently?
Repeat that question. Do we have?
We have inter-healthcare institution data stored in our database, and maybe I guess part of the question should be, or will we?
So here's the story. A lot of our patents are about data analytics. We have a couple of patents, literally, where we patented effectively a health score, or would be almost like a credit score for health. We're all about data analytics. We've been doing data analytics in healthcare for literally 25 years. Literally, I remember, contracting with IBM to give us the data analytics that sadly our providers did not have and our payers did not have. So as we said earlier, Carl said it, I said it, it's all about analyzing the data. So once you control the interaction between the consumer and the provider, you have all the data. This entire company is going to be a HIPAA compliant company. So we have all the data. So we don't have to be sort of, some of the big tech companies, I can mention a few, that are trying to get the data. And every time they try to get the data, somebody puts up a red flag because they're not a healthcare delivery company. Let me tell you something. Amazon, if you want to get data, you got to become a provider. That's what we are. So we're able to process our own data inside our systems and make a difference in people's lives. That's what the story is at the end of the day.
Right. So any closing thoughts, Noella or Carl, that you want to share with those that are still on the attendee list here?
Carl's sort of the resident philosopher, so Carl.
Philosopher. Oh, well, no, I want to thank everybody. Some very good questions. Thank you very much. I guess I just will quickly add regarding telemedicine, everything Noel said is totally true, but one of the things that we've seen coming out of this pandemic that is interesting, and that is that the patients that really need access to telemedicine are the older patients. And statistics are showing that maybe less than 4% are able to utilize telemedicine and have a telemedicine visit with their doctor. The other thing is, and there's a lot of reasons for that. We can imagine what they are, but the bottom line is they're just not utilizing telemedicine. The second thing is that telemedicine will not replace the touch. And the touch really is what most people go to their physician for. So telemedicine will fill a tremendous, not really a void, but will take a tremendous bite out of the physician practice into the. I said that backward. Will actually put a lot of value into a physician practice. Unfortunately, it's not a cure-all, as Noel said, and no pun intended in that. So the last thing I'll just say is thank you all for being here. Thank you for your questions. And any that we didn't get answered that have been posted, as Greg said, we will get back to you.
Thank you very much.
Thank you very much. And of course, we're happy to talk to anybody that has an interest and drill down on the company, drill down on execution strategy, share term sheets, etc. with you. And we look forward to the opportunity to chat with you. So Lindsay, if you want to close it out.
Yes, thank you so much, gentlemen. Thank you to everyone that joined us today on behalf of everyone from Family Office Networks. We are thrilled that we had the Axio Health team with us. And as they mentioned, we will be following up with everyone individually and are open to any follow-up conversations. We hope you all have a great day, and thank you so much.
Thank you.
Thank you, Lindsay.